You've heard about the ECFMG and maybe about the pathways. There are 6 of them. Today, I will go over Pathway 1. Pathway 1 is perhaps the best option for a lot of international medical graduates who want to work in the United States. Hello, welcome to this channel. My name is Mark. I have 20 years of experience as an English teacher working with international students and over 10 years experience working with international medical graduates who want to work in the United States. Thanks for stopping by. What is a pathway? It is a method for the communication skills and clinical skills component for ECFMG certification. ECFMG is the Education Commission for Foreign Medical Graduates. It is the institution that monitors and vets international medical graduates who want to work in the United States. They do have a clinical skills and communication skills component. Now, previously to this, in the United States, there was the United States Medical Licensing Exam, Step 2 Clinical Skills, the USMLE Step 2 CS, which was discontinued officially in 2021. This pathway takes the place of that component which tested communication skills. What is Pathway 1? Pathway 1 is for any doctor, any internationally trained doctor who is licensed to practice medicine without any supervision. If you're licensed to practice medicine without any supervision, if you do not have any problems with your license, you are not forbidden by the medical regulatory agency in your home country to practice medicine, this is the pathway for you. Now, you don't need to currently be licensed. The licensing must have occurred after January 1st, 2018. If you were licensed anytime after January 1st, 2018 to practice medicine without any supervision, this pathway applies to you. If you were licensed before January 1st, 2018, this pathway might not work for you. However, if you have taken the USMLE Step 2 CS, you are allowed to go with this path. If this pathway does not apply to you, there are 5 other pathways, perhaps pathways 2 and 3 will be better for you. We will discuss those in future videos. Now, how do you go about applying through this pathway? To apply, you will apply through the ECFMG portal itself. So you go to ecfmg.org, enter your login and password, and that will bring you to another site. You will upload the required documents that you need. You will check and see if you meet the requirements. You will then be presented with questions to determine your eligibility for Pathway 1. Here, you will also enter details about your license after January 1st, 2018. One of the documents you will need to upload is a certificate or letter of good standing. This document should show that you have no problems in operating in the country that you are currently living. You don't have any limitations, any problems, any black marks on your career. The certificate or letter should be issued by a medical regulatory agency or medical licensing authority in your home country. For example, in the UK, the General Medical Council, GMC, will issue certificates of good standing for doctors who want to apply for other programs outside of the UK. This certificate of good standing, or CSG, must be dated within 90 days of the application. A note about translations. Anything not in English must be translated. According to the ERAS site, which is the portal through which you apply for everything, the recommendation is to use Stryker translation. In addition to this, you will need to have taken the United States Medical Licensing Exam, USMLE, Step 1 and Step 2 CK. For the USMLE Step 1, you should have a passing score. For the USMLE Step 2 CK, the passing score is considered 209. However, many programs may have their own requirements for scoring for the Step 2 CK, so it's best to check with the program. You will also need to have the Occupational English Test, otherwise known as OET, medicine. The OET has listening, reading, speaking, and writing, and the requirement is 300 or above on each area. The cost for this pathway is $925, which must be paid for at the time of the application for a pathway. This $925 is non-refundable. You can pay by most major credit cards. To recap, Pathway 1 is for a doctor who is licensed to practice medicine without supervision. You are considered a full doctor or a fellow in some instances, where you don't need anyone watching what you are doing, and you can operate your own practice. You can perhaps do surgery without any supervision. This is in essence what Pathway 1 means. Pathway 1 and the other pathways simply replace the requirement met by the USMLE Step 2 CS. Is this right for you? It depends if you fall into this category. If you are a doctor who has been practicing medicine unsupervised since 2018, then this is perhaps the best choice for you. As stated, there are 5 other pathways that might appeal to you, that might be easier for you to get, and we'll take a look at those in a future video. If you like this video, please consider giving it a thumbs up and subscribing to this channel. I'd also appreciate any comments or suggestions in the comments below. Thank you very much for watching today. Have a great one.